Last year marked one of the deadliest flu seasons in nearly 20 years. And as we near the height of this year's flu season, the need for fast, accurate flu testing and early treatment is more important than ever. Getting a speedy diagnosis and starting treatment within 48 hours of the onset of symptoms can help a person bounce back faster and help keep loved ones in our communities safe. Here with tips for navigating this flu season are Dr. Norma Moore, Director of Scientific Affairs for Infectious Disease at Abbott Diagnostics, and Dr. Douglas Ambler, Medical Director of Quality for Northwestern Medicine Regional Medical Group. So hello again to both of you. Hello.
Good morning.
Thank you.
Dr. Ambler, let's review what flu is and how it differs from the stomach flu.
Yeah, absolutely. That is a very common question this time of year. And so both are viral infections. So when we talk about stomach flu, however, that infection is strictly limited to nausea, vomiting, and diarrhea. The stomach flu does not have any respiratory symptoms, whereas influenza is all respiratory and does not have any stomach symptoms. So it's typically going to be much in the way of headache and runny nose, cough, high fever, 101, 102, 103 fever, a lot of body aches. Common cold is also a virus. It's not nearly as severe of an illness as influenza. And then when we talk about the flu shot, we're specifically talking about the flu vaccine to treat influenza for prevention. It will not prevent the stomach flu and will not prevent the common cold virus.
Okay, and Dr. Moore, why are some people more susceptible to flu than others?
Well, one of the difficulties with influenza is there's so many different types. Therefore, you can get it this year, get immune, but again, you're exposed to a different influenza next year, you can get it again. The big worry, however, is especially the young and the old. When you're talking about kids, they don't have the full immunity that they've been exposed to so many other things, so they can be at risk of complications. And again, when you're over the age of 65, your immune system starts to wane, and therefore we worry about the parents, the grandparents, when they get sick. Beyond that, we worry about things like pregnant women, people with underlying conditions, asthma, for instance, and anybody immunocompromised. All of those people are more susceptible to those complications, so we want to do our best to avoid them getting influenza to begin with.
Okay, and Dr. Ambler, why is it so important to get started early if a person develops flu?
Yeah, the main reason why it's so important, why time is of critical importance, is we know that if we can get a patient seen within 48 hours of the beginning of their illness, we do know that our treatments, the antiviral medications that we have available, can really help, especially those high-risk patients with all the chronic medical conditions that Dr. Moore was referring to. So we really do have this 48-hour window, so that's why if someone's developing those flu symptoms I mentioned earlier, we really want to get those high-risk patients into the office as soon as possible.
Okay, and Dr. Moore, how does one know if they have the flu, and is there any technology available to help?
Well, that's one of the issues is with influenza, quite often it can mimic community-acquired pneumonia, or even some of the most severe colds can be confusing. So without a test, you really can't know. So we here at Abbott have developed a test called ID Now, where
I'm sorry, what's the test called?
The test is called ID Now.
Okay, ID Now.
Yes, and that helps you identify those tests while the patient is there. So quite often in the past, you had to send results to a laboratory, and if it took hours to days to get the results, it didn't help change those prescribing habits. So if the patient was demanding an antibiotic, it did no good whatsoever. So by bringing those tests close to the patient, hopefully you'll get them on the right medication to get them back healthier faster than before.
And why is prevention so important?
Well, prevention, again, is so important because we just came through a flu season that affected a lot of people. We had about 80,000 deaths last year alone. It was an extraordinary season. So the whole issue with this is the better we each take individual care, the better we all are. So by me taking a vaccine, I am helping not spread it to, again, the more vulnerable populations, the kids, the grandkids, the adults. All of that sort of issue helps go away when we all take those cares. So as much as we can do, the vaccines, washing our hands, the very simple things will help us all keep safe.
Okay, and the flu vaccine, I guess, is the most important thing?
It is absolutely one of our more critical efforts to fight influenza, absolutely.
Okay, and Dr. Ambler, what advice can you give to a person who has been diagnosed with the flu?
Yeah, and so like Dr. Moore was alluding to, we definitely don't want to prescribe antibiotics for any type of viral illness, whether that's stomach flu, common cold symptoms. And if we have influenza that's been diagnosed and it's been within that 48-hour window, then we do want to start antiviral medication. But otherwise, getting your rest, drinking plenty of fluids, not going back to work or bring your kids to daycare immediately. You want to be fever-free for a minimum of 24 hours before you do those things. I think if we can take all those things into account, people hopefully will get well as fast as possible.
Okay, well, let me thank both of you for that advice. I'll be sharing that with my Health Power audience, and I'm sure with the flu season upon us that they will take your advice, get early vaccine, and also be very careful about cleanliness, washing hands, and so forth.
Well, thank you. Good luck to everybody.
Absolutely.
Okay, thank both of you, and have a good day.
Great, thank you.
All right. So long.